We will begin with item 4, a report on the findings of the Williams Institute's Lived Experiences in Los Angeles County survey and the County Transgender and Nonbinary survey. For members of the public on the telephone, please press 1 then 0 now to comment on this item. I couldn't be more thrilled to say today we have Dr. Barbara Ferrer, Director of Public Health, Brad Sears, Founding Executive Director, and Jody Herman, Senior Scholar of Public Policy, both from the Williams Institute, UCLA School of Law, and Bambi Salcedo, President and Chief Executive Officer of the TransLatin Coalition, who will make a presentation. They are joined by Dr. D'Artagnan Scorza, Executive Director of Racial Equity, and Sunitha Menon, Executive Director of our LGBTQ+ Commission, here are also available for questions. I want to thank everyone for joining us here this morning. We know that the many challenges that our LGBTQ+ communities face, from accessing gender-affirming care to living free of hate and discrimination, deserve our attention and our investment. And I thank you for the work that you have done in that way. If we're going to tackle problems of disparities and discrimination, we have to collect the data to target our approach so we can reach out to those who need it most and measure our progress. As we celebrate Pride Month, it's incredibly important to remind ourselves of why we do this work and the progress we continue to make, as today's presentation will make clear. We know our study is robust and comprehensive, so we won't be able to discuss all of the details of the entire report, and we're all sort of laughing a little bit about that only because the report is so rich that I hope everyone takes the time to really dive into the details, because it is absolutely incredible the work that they have done. But that being said, our overview today will be extremely valuable to help inform our policy work and our public about the status of our LGBTQ+ community in Los Angeles County. So I want to extend my heartfelt gratitude to the Williams Institute, our TransLatin Coalition, Department of Public Health, and everyone joining us this morning to share this valuable information. I'll now turn it over to you.
Good morning, and thank you so much, Supervisor Horvath and the entire board, for the opportunity to be here with you today to discuss the findings of data collection efforts about the lived experiences, health, and well-being of LGBTQ individuals living in LA County. I'm pleased to be here today with impressive collaborating partners, including our colleagues from the Williams Institute at the UCLA School of Law, Brad Sears and Jody Herman, and with Bambi Salcedo, the exceptional Executive Director of the TransLatin Coalition. And they will share the key findings from the lived experiences in Los Angeles County surveys, the 2023 Los Angeles County Health Survey, and the Los Angeles County Trans and Non-Binary Survey. So there are 3 surveys that we'll be looking at data from. I'm also pleased to be joined by Dr. Scorza and Executive Director Menon of the county's newly formed LGBTQ+ Commission. I do want to take a moment to recognize the critical work that's being done by both the TransLatin Coalition and the Williams Institute. For the past 15 years, the TransLatin Coalition has been a courageous leader in the county for Latino, Latina, and immigrant, transgender, gender nonconforming, and intersex, or TGI, individuals. Their highly impactful advocacy, perseverance, and deep commitment to justice has resulted in policy and practice changes that have improved the ability of Latino and Latina and immigrant TGI persons to have the necessary resources for their well-being. Our colleagues from the Williams Institute, a nationally recognized center that conducts research on sexual orientation and gender identifying law and public policy, are also with us today. The Williams Institute is instrumental in generating high-quality data and scholarship about LGBTQ individuals to ensure that their research can then directly inform laws, policies, and judicial outcomes at the local, state, and national levels. At the Department of Public Health, as we strive to center justice in all the work we do, we're grateful for this collaboration that allows equity efforts to be guided by high-quality information that accurately reflects the lived experiences of the people we are in service of. Today, as we report back from these findings, You will hear data that comes from the LA County Health Survey. This is a cornerstone of this presentation. It's a powerful tool. The 2023 wave of this survey successfully oversampled individuals who identified as LGBTQ. Of the almost 9,400 adults who participated in this survey, over 1,000 identified as LGBTQ, and half of those individuals also participated in the LELAC survey, which is the Lived Experiences of Los Angeles County survey. From the data from these surveys was used in today's presentation. And also, you'll see it in a robust report that we co-released this morning with the Williams Institute so that we can contextualize the differences we see in health and well-being between LGBTQ and non-LGBTQ individuals that live in our county. As we review the findings from these 3 surveys, I am reminded that behind every data point is a person, a family, and a community. And I want to express my deepest appreciation to all the individuals who took part in these surveys. I hope that the information gathered through these surveys will be used by community organizations, local leaders, elected officials, and residents to prioritize efforts to optimize the health and well-being of the LGBTQ plus members of our community. I'll now turn the floor over to Brad, Jody, and Bambi so they can continue with the presentation.
Great, thank you. And I want to start by thanking Dr. Ferrer and her incredible team for a really rich and deep collaboration. We're presenting the findings of 3 different surveys today. They're published in 4 different reports, and they represent the voices of 1,000 of the 665,000 LGBTQ people who live in Los Angeles County. And I also just want to acknowledge each of the supervisors who supported this report with funding, so we were able to do this incredible work. If we go to the next slide, I'm going to be very brief and just present 7 key takeaways from this report and give a few examples and then turn it over to my colleagues. First, Los Angeles is a beacon of hope and pride throughout the country and the world for LGBTQ people, but the kind of principal response we got when we asked people, what do you worry about? What do you want to tell elected officials? Is the same as so many people are struggling with in the county. We can't afford to live here. LGBTQ continue to come here, make the county unique, but they're struggling to stay here and to meet the cost of living. LGBT people face unique barriers, which I'll talk about in forming community and family, which is important when we're thinking about services that rely on that community and family support. That's different for LGBTQ people. Despite our great policies and a supportive environment overall, many are still in the closet, and you can keep clicking through the different themes. Many are still in the closet and face ongoing discrimination and harassment, and I'll give some examples of that. Another key theme is people in the communities, their safety concerns. They're experiencing harassment on the street, they're experiencing crimes and violence, and they don't often feel safe turning to law enforcement to address their safety concerns. All of these issues result in disparities in mental and physical health as well as in their socioeconomic situation. And I'm just gonna end by saying, LGBTQ people overwhelmingly know this is a great place to live. They know that you are supportive and welcoming of them, and they're engaged in not only making the county better for themselves, but for everyone. If we go to the next slides, I'll give you just a couple of examples of the main theme. Despite a long stereotype that LGBT people have more money or are wealthier, that's not true. They're just as likely to be in poverty or have low incomes as people in the county overall. About 1/3 are living about 200% or below the federal policy level. That's even higher. Almost half of trans non-binary people are living at below 200% of the federal policy level, and higher for people of color. If we go to the next slide, we can see this theme running through any measure of kind of economic inequality that we look at. This is a slide of food insecurity. Did you have enough money to get the food that you and your family needed last week? About 50% more LGBTQ people said they do not. You'll see a couple of themes running through subpopulations within the LGBT community that face greater disparity. consistently people of color who are LGBTQ, and people who identify as bisexual, who tend to be younger and also more likely to be people of color. If you go to the next slide, obviously housing is a big concern in the county. LGBTQ people are more likely to be rent burdened than non-LGBT people, and as this slide shows, they're more likely to be unhoused. Now we're gonna turn to the second theme, if we go to the next slide, and look at the barriers that people in the community have, the greater barriers to forming family and community. A friend of mine calls the LGBT community a reverse diaspora. We think of a people in a diaspora as being together and scattered. For the most part, LGBT people are still born in non-LGBTQ households, and they have to find each other and build community. Many face family rejection, and you can see by the yellow and blue columns on this slide that those identified as bisexual are much more likely not to be out to anyone in their immediate family and any of their LGBTQ friends. If you go to the next slide, when it comes to forming families, we have better laws, policies, and support for people having their relationships recognized, for having kids and parenting, but they still face barriers, and particularly when it comes to parenting, economic barriers to having and raising children. When you put all that together, it means that LGBTQ adults are about twice as likely to live as alone as non-LGBTQ adults, and that's even greater for those who are older. Our Surgeon General has talked about the epidemic of loneliness we have in this country, and we see higher rates of loneliness for LGBTQ people. So when we build programs that rely on family and community support or assume it, that looks different for LGBT communities. If we go to the next slide, we'll see that even though this is a great place, we have good policies, and there's more support here, and we look good when we compare these numbers to national figures, people still face discrimination and harassment for their sexual orientation and gender identity. We looked at 9 different areas, and about 1 in 4 LGBTQ people reported discrimination in one of those areas, including employment. And if you go to the next slide, that's similar for harassment, even higher rates, about 40% experiencing harassment in one of these areas, including the past 5 years. And again, I'll point out those top 2 bars, which look at experience of harassment by coworkers and by customers at work, happening to about 1 in 8 LGBTQ people in the last 5 years in LA County. So we have the laws, but we need to have the training, the enforcement, and the monitoring to make sure that those laws translate to real differences in people's lives. The next theme I'm going to look at is safety within the community, and I've talked about some of the disparities, if you go to the next slide, people have in being harassed on the street or being victims of crime. What we asked is, how do your fears about safety shape your daily lives? And what we found is that people avoid public places like beaches and parks. They avoid public transportation to protect themselves. This is Pride Month. They also avoid going to Pride festivals, and they avoid going to LGBTQ establishments. And in the great kind of qualitative part of the study, we have a number of people telling really painful stories about being harassed on their way to or at a Pride event and calling for more protection for the community. If you go to the next slide, when they turn for that protection, it's often to law enforcement. We asked our survey respondents to evaluate 14 different service areas in the county. The bottom 4 all had to do with the criminal legal system, the sheriffs, the prosecutor's office, the DA, public defenders, probation, and jails, all ranked at the bottom. People are still experiencing harassment by law enforcement as well, as this slide shows. So this is one area we definitely see where further work needs to be done. And if we go to the final slide, I'll just end with this. This is an incredibly engaged community. They are more likely to volunteer, to give to organizations. They are more likely to contact you and other elected officials, about twice as likely as non-LGBTQ people. And they just don't do that on LGBTQ issues. About 80% of the people we surveyed are active in one of these areas. And of that 80%, thanks. Let's go on to the next slide. We're going to go on to Jody Herman. So just, if you page through these, we'll go to the next presentation. Thanks.
Good morning, everyone. I'm Jody Herman. I'm the co-principal investigator of the LA County Trans and Nonbinary Survey. And Bambi, introduce yourself.
Buenos dias, good morning. Thank you so much for the opportunity to be here before you. I'm not sure if there has been another trans woman presenting here in front of you, but thank you so much for the opportunity, Bambi Salcedo with the TransLatin Coalition in collaboration with Jody Herman and Williams Institute.
I also want to acknowledge our co-authors, Kim Chatham, who's here with us today, Lindsay Mahold, Queen Victoria Ortega, and Alana Redfield, all part of the team. First, we want to thank the board for your support of this study. This study is a counterpart to the LELAC study that Brad just presented. We surveyed a community sample of trans and non-binary people in LA County to learn about their needs and barriers to services. And we had 322 respondents from various parts of LA County, including from each county district. Next slide, please. Respondents selected from a list of issues which they consider to be serious problems for trans and non-binary people in LA County. Over 50% of the sample said that each of the top 4 items were serious problems. These issues have to do with aspects of economic well-being, which includes housing. They were also concerned with exposure to violence and needing access to mental health care. 52% of our sample was living at or near 100% of the federal poverty line, and 74% said they were housing cost burdened, which is much higher than LA County generally. So clearly, issues related to economic well-being were most salient for our sample, and that concurs with findings from the LELAC study as well that Brad just presented. Next slide, please. We found that despite again, echoing findings from the LELAC study, that despite the positive public policy environment, discrimination and mistreatment persist for some trans and non-binary people. For example, 70% had taken actions at work to avoid discrimination, such as staying in a job they preferred to leave. 29% had at least one negative experience with a boss or coworkers in the last 12 months, including being forced to resign. 21% believed that they had been denied housing specifically for being trans or non-binary. And 29% reported mistreatment or being misgendered during a recent routine healthcare visit. These negative experiences persist despite the positive public policy environment. So as Brad says, we need to make good laws actually make a difference on the ground. Next slide, please. We asked our respondents about how they access services and programs in LA County. Most say they go to LGBT-focused or trans-focused community organizations to access services and programs. And of those who use community organizations for services, 50% said they are less comfortable accessing services at government offices compared to community organizations. I think that is related to our next 2 findings, which are about people's experiences applying for government benefits or services or visiting a government benefits office. 57% of those who had applied for government benefits or services had one or more problems because they are trans or non-binary, such as avoiding going to the office altogether and being denied benefits or services for reasons other than eligibility. 33% of our sample had visited a government benefits office in the last 12 months, and 48% of those reported being harassed, misgendered, or denied access to appropriate bathrooms by staff or security. So these negative experiences are likely related to the lack of comfort that trans people express for using government services and going to government offices. And now I'm going to turn it over to Bambi to discuss some of the recommendations that emerged from the study.
Thank you so much, Jody, and thank you once again, beautiful and amazing Board of Supervisors for the opportunity to be here. And can we go to the next slide, please? Obviously, hearing the results of these findings, right, it's important for all of us to work together and to ensure that we address the specific needs of transgender and conforming intersex people who live in Los Angeles County. As we know, TGI people have been neglected for many years, and it's important that we continue to work together to address these issues. In this survey, we asked people what were some of the things that were important that government leaders can do to support their livelihood. And what we found was that, as we heard, right, financial hardships are one of the concerns of our community. As we know, TGI people continue to be one of the most poor people anywhere in the world. And it's important for us to understand what needs to be done in order to uplift their livelihood. Obviously, the continuous discrimination that we face as people simply because of who we are is one of the things that continue to hinder the way we live our lives. And so we need to think about, like, what is it that we need to do to be able to change the minds and the hearts of people and really put actions into making sure that the discrimination that we face do not continue to happen. Obviously, what we need as people and what the respondents in the survey said is that we want to be seen and respected as people, right? We're not asking for anything else, but just to be validated as who we are as people and understanding that there's this human connection that we all have. And what do we need to do to ensure that we are respected and appreciated as people? And obviously, it has been mentioned that having negative experiences with government entities and officials is one of the recurring themes. And so what can we do to ensure that we don't continue to have this negative experiences, right? How can we ensure that county officials and representatives, right, really understand that they can continue to do this, right? That we do have the right to have access to the services that the county have for all of us, right? And people need to be able to change their ways of thinking about who we are as people. Can we go to the next slide, please? Obviously, we need to make sure that we improve the quality of life of our community. And public safety, as we know, is one of the things that it's important to our community, but it's important for us to also understand that public safety doesn't mean necessarily that it's the police, right? That there are other resources and community spaces to where people can have the safety that they need. But also, how do we make sure that we empower members of our community to be able to be connected? And I think it's important to also understand the population that are here in Los Angeles County. The Williams Institute recently released a report in which they stated that there are about 41,000 trans migrants around the state of California. And understanding that the majority go to either San Francisco or Los Angeles, we can estimate that at least 10,000 trans migrants live in Los Angeles County. And obviously, it's important for us to improve the service delivery for trans people and really understand the support that we need and how we are going to be able to provide the support that our community needs. Obviously, accessibility to identification documents is one of the things that are important to our community. And we need to make sure that we support members of our community, not just those who are immigrants, but also those who want to have documents that align with who they are, for them to be able to have access to employment and other services. Can we go to the other slide, please? One of the things that I do want to also mention is that we want to think about how can we collectively create better futures for members of the transgender and conforming intersex community who live in Los Angeles. And in order for us to be able to do that, there has to be that collaboration between our government and those organizations that provide the support to members of our community. And so we need to be able to invest in the livelihood of our community and invest in the future of members of our community. We know that there are many issues, including workforce development and access to the workforce and other things, the arts and other things. And so we need to be able to really improve the quality of life of our community. And I think it's also important to mention that the work that the TransLatin Coalition does here in Los Angeles is not specific to the Latino community, right? The work that we do uplifts the livelihood of all members of the transgender and conforming intersex community. And it's also important to understand that we need to also develop the infrastructure of our communities, right? And those organizations that also provide services for members of our community. As we know, members of our community feel better or, seek community better than getting services from the actual county departments. And so, can we go to the next slide, please? Again, one of the things that I think is also important for us to understand is that we need to create pathways or pipelines, right, to uplift our community. We want to create pipelines to ensure that even within the county, right, that they are people who look like us, right? We want to see ourselves reflected. We want to see that we are able to be integrated into the tapestry of our society. And we want to, we want to make sure that there is an investment on that. As we know, many members of our community have not had the opportunity to have access to education and other things, right? I can honestly say that about 2 to 3 generations before us were completely neglected. They didn't have any access to services. And those are the individuals who right now are also struggling with their livelihood. Those individuals who are aging. And so we need to also pay attention to those members of our community and be able to provide the support that they need. And so this is an open invitation to all of us to work together and to ensure that we better live the livelihood of transgender, nonconforming, and intersex individuals who live in Los Angeles County. I think that concludes my presentation, and now I'm going to turn it over
I'll close
to Dr. Ferrer. Yes.
Thank you, Bambi. Muchas gracias. Thank you so much, Bambi, Brad, and Jody. I do want to close out by, I just want to share the health impact of systems that don't work well. The report reveals stark inequities in health and well-being for LGBTQ individuals when compared to non-LGBTQ individuals in the county. And I'm just going to lift up some health outcomes. Depression was twice as common amongst LGBTQ as non-LGBTQ people. Lifetime suicide attempts were 4 times more common amongst LGBTQ people than non-LGBTQ people. About 1 in 4 individuals who were LGBTQ expressed that they have an unmet need for care, health care, in LA County. And that the primary barriers to getting care not only involved cost, but 1 in 3 were unable to find care supportive of LGBTQ individuals. Twice as many LGBTQ people have experienced intimate partner violence when compared to non-LGBTQ people. And this includes half of bisexual women. More LGBTQ than non-LGBTQ individuals in the county are living with a disability. And the rate there is 41% of LGBTQ individuals have a diagnosed disability. 1 in 10 LGBTQ individuals in LA County in the past year did not go to any healthcare provider to avoid unfair treatment. And in the past 5 years, 8% reported that they were denied or provided inferior medical care because of their sexual orientation or gender identity while living in LGBTQ in LA County. Almost 4 in LGBTQ individuals also reported not being out to any of their healthcare providers. I want to acknowledge that here at the county, there are efforts across many departments to lift up the LGBTQ plus communities and to address the challenges of systems that aren't working. Certainly here at the Department of Public Health, we have efforts among substance abuse prevention and control. We have our student well-being centers. We have our Division of HIV and STD programs. We have the Office of Women's Health and the Center of Health Equity, just to name a few areas where we have programs. But I want to note that it's not going to be enough to stand up programs and services while institutions, policies, and laws are often creating and perpetuating these inequities. Our collective mission needs to be to break that cycle of discrimination, racism, stigma, invisibility, and marginalization. The work we do together is going to be more successful if it's rooted in justice, and it's striving to dismantle these oppressive systems so that we can improve the well-being of those that are experiencing these unfair outcomes. I'm grateful for the extraordinary leadership of this board, and I stand ready to work hard with the newly formed LGBTQ+ Commission, other county departments, community collaborators, and residents to address the needs and improve the lives of our LGBTQ+ community members. While I know the challenges are significant, so too is our collective resolve to address them head-on, inspired by the courageous leadership seen here today and the belief that good health is a right for all. With that, I thank the entire board for their time, and we're all available for questions.
Thank you very much, and happy Pride Month. This work is worth celebrating. Thank you very, very much for your leadership and investment in this work. And we're especially grateful to the Williams Institute for your dedication to researching and advocating for the LGBTQ+ community throughout the country and here in LA County. And I know some may know that Williams Institute is a large part of the reason why I am here in LA in the first place. And I want to thank you for the life-saving, world-changing work that you do. I'm just incredibly in awe of your work. The findings presented here today highlight both the progress we've made, but also the challenges that remain for our LGBTQ+ community in Los Angeles County. And that includes health disparities, economic challenges, social discrimination, and so much more. It's clear that our work must continue, and there's a lot to be done. And this data helps us in much more ways than just being numbers. It reflects true lives, the lived experience of Angelenos, and who are our friends, who are our neighbors, who are our community members. And like all communities, our LGBTQ+ community is not a monolith, even as shown by the letters in the acronym that we say. There are very different experiences within our LGBTQ+ family. And as a county, we are committed to responding to your findings with concrete action. That is our responsibility, and we are ready to take up that charge. I have a couple of questions in 4 different areas. First, I want to talk about violence and safety. This report found that over a third of LGBTQ+ adults experience intimate partner violence, which is double what non-LGBTQ+ adults experience, as Dr. Ferrer just said. This disproportionate impact also especially highlights the experience of bisexual women, which is even greater. So how is DPH taking action, including with resources and funding, to address the systemic challenges of intimate partner violence in our LGBTQ+ communities, recognizing that there are different kinds of experiences and different ways to appropriately respond?
Yeah, thank you so much, Supervisor. And I do want to start by thanking the entire board, because many of the activities that the Department of Public Health is engaged in is because of your support and your direction. So particularly in the areas of domestic violence, intimate personal violence, and our Office of Violence Prevention, you've increased resources in all those areas and asked us to pay particular attention to communities that are most vulnerable. So I'll give a couple of examples, but I want to start with sort of the principle for us is the partnerships with our community-based organizations are the most important. That's where much of this work is happening, and our ability to make sure that the dollars we have are actually going out to those community based organizations like the TransLatin Coalition to support their work is where I think we're going to start seeing a difference. One of the things that we've done is with our increased ability to support domestic violence shelters and the domestic violence supportive services providers is we actually are offering a lot of trainings to those organizations, and we do that with the National LGBTQ Institute on Intimate Partner Violence. They have trainers that are housed at the LGBT Center that we're using so that as folks are seeking support, we are recognizing the unique needs and being responsive to the LGBTQ plus community at these sites that are meant to be safe spots, but often aren't necessarily, we don't necessarily see that reflective in inclusive policies. So I think there's been a massive training effort, and I want to thank all of our shelter partners and our domestic violence supportive services partners for their willingness, and for many of them for their leadership in creating spaces that are both safe and inclusive. I also want to note that the Office of Violence Prevention is working with the CEO now on prioritizing gender-based violence, and in particular paying attention to violence against members of the LGBTQ plus community, in particular the TGI community, so that we address head-on places and spaces where we're seeing actions that are being taken that are not supportive. And us as a public health department, we also need to make sure that our services and supports are appropriate. So we have started looking really hard at where our own policies are, not just on sort of how we create our own welcoming spaces and places where everyone can do their best work, but also on how we're supporting, what percentage of our funding is supporting organizations that are doing this work in the community, and then what other issues are we hearing from the leadership in the community. And I was so glad that that was highlighted today. You know, what's the pipeline for us to make sure that our jobs are in fact open, respectfully recruiting members of the diversity that we see reflected here today. So I think in all, those are like 3 areas where I just wanted to highlight some examples.
That's great. I think it's important to know what work is being done and that we are making those investments. And this report also reveals that we still have a lot of work to do. And so I know that our LGBTQ plus commission will help guide how we can make those policies and actions and investments that much more inclusive. And more broadly, this report continues to detail what we already know, that our LGBTQ plus community members are at risk of, increased risk of violence in their own communities, in LGBTQ plus community spaces, and in LGBTQ plus nightlife, often underreporting hate crimes and violence, fearing retaliation, or believing that their concerns will not be responded to by our public institutions, which includes law enforcement, as your report highlights. It also details significant ongoing problems that our LGBTQ plus communities experience with law enforcement: verbal and physical harassment, sexual assault, discrimination, and mistrust. So I want to turn to Dr. Scorza. Can you talk a little bit about any information that you've gathered and recommendations you're acting on with regard to safety and law enforcement with our LGBTQ plus community, given our community safety motion from last fall? What kind of progress are we making in that regard?
Thank you so much for that question, Supervisor, and it's a pleasure to be here with each of you this morning, along with my colleagues here presenting on this very important topic. So, Supervisor, I'll just briefly start by saying that RD is working very closely with multiple county departments, including the Sheriff's Department, Library, the Human Relations Commission, our partners here in the Department of Public Health, and others to improve data reporting on violence against people on the basis of their identity. So hate crimes, hate incidents in LA County. What we've been able to identify in our most recent report back in June was that there was a need to continue to enhance and diversify community-based pathways to support survivors of crimes and incidents and enable them to navigate reporting their experiences, that we need to expand places for them to report. And while 211 and the partnership that we have with HRC has done an incredible job many folk, as has been pointed out through this report, have demonstrated that they don't necessarily want to go to law enforcement, right? So we need to have different reporting mechanisms. The other, I think, challenge that we're finding in the field is that there's not a lot of common definitions for reporting non-criminal hate incidents as well. And so in partnership with this internal work group, we are working to identify how to best define what a hate incident is so that it can be reported and tracked so that we can better establish those referral pathways. In our upcoming report back, we will talk a bit more about strategies to improve LGBTQ plus resident safety, along with a partnership with along with bringing in extensive stakeholder interviews. And the report will provide a community-sensitive site safety blueprint, which will offer best practices and resources for individuals, county staff, and other event organizers to help secure those safe, sites that may be targeted on the basis of identity. And then finally, again, in partnership with the Sheriff's Department, HRC, and the Chief Executive Office of Emergency Management, we're working now to coordinate a response to identity-based hate. In partnership with CEO OEM, we've assembled resources relating to community safety and emergency response, and that's currently available on our website. So that was posted last week, I'm excited to say. So if folk want to access those resources, they can go to ceo.lacounty.gov/arty. And finally, we'll be providing training to uniformed officers and non-law enforcement staff to ensure they understand policies related to hate in order to serve our communities with dignity and respect. And so we've brought in some external training partners being supported by additional grant funding to help train our law enforcement and non-law enforcement county staff.
Thank you very much. And again, we know that these issues manifest in different ways depending on the members of the community. And so we know our TGI community in particular will face unique challenges that are different than the broader LGBTQ+, and layer in the experience of people of color. That just adds even more complexity. So I'm glad that we are taking all of that into account as we are making those improvements and offering culturally sensitive training and making sure that people really understand the diversity of Los Angeles as we all intend to serve it. The second area I want to touch on, which you really highlighted in your report, is housing and affordability. At the core of this report is that fundamental issue. Affordability and the cost of living contribute to so many of the challenges that the community faces. The ability to afford an apartment, access healthcare and transportation, to start a family, all of these are out of reach for so many of our LGBTQ plus family members. And LA County has a reputation, thank you for saying that we do have a reputation of being an accepting place, but our data makes clear that it's becoming unaffordable for many people who want to come here into this safe place. So can you talk a little bit more about your assertion that affordability is an LGBTQ plus issue, and what concrete recommendations would you make to resolve our disproportionate struggles, both within LGBTQ plus community and outside of it? As I know it's a very broad question, but I'm sure from your research there are particular highlights or specific areas that we should be diving into as we are tackling that very broad question.
Yeah, thank you so much for that question. And I'll start a little bit with the why and then a little bit about what we can do about it. And so part of the why is that LGBTQ people do experience discrimination and harassment. There is about double the rate of unemployment despite not being much disparity in levels of education. I think you also have to think about the fact of who does LA attract from the rest of the country. It's still true that, youth, if you go to the Greyhound bus, the people are getting off the bus, people are getting off the train, they're coming here, fleeing other parts of the country, of the world, that are not as supportive. And so they arrive with less resources. They might arrive after family rejection and no support from family, and then have to kind of build their lives, including economically here. So the kind of pathways, kind of in and out of poverty start with a lot of folks here who are lower income. This is a community that is more diverse racially and ethnically than the LA County population overall. It's also younger. And so part of what we're seeing with the disparities in housing, being overly rent burden and food insecurity also has to do with a younger and more diverse population facing kind of layers of disparity and vulnerability. Some recommendations for specifically what needs to be done. I guess I'll start with this, and kind of building on the last conversation dealing with safety, is that what came through loud and clear is, yes, the community wants allies. Yes, they want training and monitoring. They want programs to be accessible. They also want recruiting and hiring. So it's not just about having well-trained allies in place. When people walk through the door of a program or access services, they want to see someone like them there, and that's going to make them more likely and feel more welcome to access services. So that is key. The second thing I would think is, to the extent that we're thinking that community and family provide some level of support or wraparound, that's less likely to be true for LGBTQ people. And I want to bring in one more community layer, which is people of faith. Many LGBTQ people are people of faith. We have a number of organizations that either kind of work with government or on their own provide services, food banks, housing to communities. We have very high rates of people in the community who identify with a religious or spiritual community saying they're not out to anyone in that community. And here too, bisexual people tend to be the ones most likely not to be out. They also void those spaces as well out of fear of unfair treatment and safety concerns. So to the extent there are partnerships with organizations that are faith-based, that's something else that has to be taken into account in providing services. I'll stop there and let Bambi and Jody chime in.
Thank you again so much for the opportunity. And I also want to acknowledge the partnership that we have with the Williams Institute, and me, myself, being one of the co-project investigators. Again, I think having that privilege and the opportunity, it's important to recognize, because not many transgender, nonconforming, intersex people do have that type of privilege and opportunity. So thank you so much. And also having the opportunity to be here before you to address you. So, you know, we heard some of those recurring themes, right? That our community are saying, this is what we need. And what we need is to really understand that we need to ensure that trans people are moved from surviving into thriving, right? And some of those things, some of those ways that we are able to do that is going to be to really invest in the livelihood of our communities. And we are talking about these pipelines, right, that needs to happen. And the truth is that the first thing that is going to happen is that organizations that support the community are the ones who are going to be able to start doing that work. And then obviously, with the collaboration of the county services and the different departments, we can also, you know, build that pipeline, right? I also want to mention that the city of San Francisco has invested like some money specifically allocated for TGI people. And it's like a stipend that TGI identified individuals get. It's like an allowance. I think they get like about $1,000 a month. And I think that is important. That helps for the cost of living, right? The work that the TransLatin Coalition does through our workforce development and other programs, we try to provide incentives, but obviously the grants that we get do not provide the ability to really uplift the livelihood of TGI people as they need and deserve, right? And so we certainly do our best, but I think if there's a specific allocation that will support TGI people to make sure that they are, that they have enough money to pay for their rent, that they have enough money to pay for food, that they have accessibility to get employment, right? And all of those things, I think those are super important. And we're also super grateful to the Human Relations Commission here with Los Angeles County and obviously Dr. Scorza and all of the work that we have done to listen to the needs of the community, right? And this is what the community is saying. And so I think if we ensure that we work together to uplift the livelihood of TGI people the way we deserve and the way that we need, we can definitely make the future better for all of us.
Thank you. Thank you for the work that you're doing. And it is clear that our workforce development opportunities as well as housing opportunities need to be intentionally more inclusive in how they are providing those services. We know the unemployment rate for transgender and gender non-binary Angelenos is 28% compared to 5% for cisgender counterparts. So there's a lot of work to be done in that area. Two more areas I want to touch on. First are families. The report details the majority of LGBTQ plus people want to create families, but many barriers, especially financial barriers, stand in the way. So to our county family members, what is our county doing to help support our community members to have the ability to grow LGBTQ plus families? Are there community or county partners that are experts in this area that we're partnering with? And how are we bringing them in to support the growth of LGBTQ plus families in LA County?
Thank you, Supervisor. I'm happy to start. I know there are other departments not up here that are also playing a very big role here. I do want to start with, again, like sort of a systems issue, which is the cost of having a family, is out of reach for many people. And it's particularly out of reach for people who are looking towards in vitro fertilization or other methods of being able to have a child. I think California has done a great job about thinking about what is the responsibility of health plans, but I would say we need to take a hard look at that. This should be a covered service for everyone. That would go a long way towards making some of the barriers to having a family disappear for many people in different communities, and I think we could work harder on that. Again, and I want to note that this state actually has been way more generous than many other states, but I think we have a lot of room for improvement here. And I'm not talking about just our public plans. I'm talking about, in particular, working with the private health plans, which is where I think we see the biggest gaps in coverage. So I also think there are opportunities for us as a county family to, again, look at our policies around family leave that really, again, acknowledge that for some people, they're going to need more time on the family leave side to, in fact, go through a longer process to bring their families together. And let's make sure that economically we're figuring out ways to support that. I think from a programming side, there's also a lot of work we can do. I've actually started meeting with some of our home visiting partners because, again, I think our home visiting services can be extended to help folks who either have a family or would like to have a family negotiate and navigate the complex world. I mean, we already saw a lot of data of folks not feeling like they're getting support from the healthcare system. So certainly we have work to do just with our own partners in healthcare around making sure that that navigation becomes a lot easier. But I think those are like the three areas where we've identified that there's possibility for us to better work.
And finally, it wouldn't be a conversation for me if we didn't talk about our young people. Our LGBTQ youth in particular are facing an outsized, organized, well-funded campaign to eliminate their rights to privacy, bodily autonomy, just their basic right to exist. So while collecting data on our LGBTQ youth can be challenging, what steps are you taking to gather more data to better understand the needs of LGBTQ plus youth, and how would you recommend we at the county learn from your experience to incorporate that into our practice to better serve our youth?
Yeah, I'll jump in first, and it's important to keep in mind this is a survey of adults. We did ask some questions about people's education-based experiences, but we had adults. We had people as young as 18 and people in their 80s responding to the survey, and I really encourage you, if you have the time, to read some of the quotes from folks and get an extremely diverse group of people saying very similar things from very different perspectives, including on affordability. I think what's unique about this survey is the sample size and how many people have, so we can sit here and talk about the different experiences of needs of bisexual men and women versus trans non-binary folks and lesbian and gays, of people of color versus white, of low income versus high income. We have a report that will follow basing on immigrants. That's only available because we have we put a lot of resources into a big sample size. We need the same thing for youth. And I think we've done that here in LA County before in partnership with the county and the LGBT Center. We did this, kind of historic study about youth in our foster care system that was kind of a game changer, but it took an incredible amount of time and resources. Obviously, it's more complicated in reaching youth, but I think those investments are really important. The data we did gather about people's experiences in school still shows in this county a lot of discrimination and harassment, including people who went through K through 12 in public schools here in LA County. Not full implementation of the state's requirements in terms of the type of curriculum that's supposed to positively cover LGBTQ people and health issues. So we saw with a limited amount of data those needs, but it would require all of us working together to really do a survey that would provide that for youth, like we have this great data for adults.
I would also chime in, we have 39 student well-being centers, and I would invite the board to come and spend some time with us, because these are safe places for all youth, but particularly for youth who are feeling marginalized and bullied. And part of the effort at the student well-being centers is we train youth peer leaders really to head-on confront cultures at schools that are filled with oppression and discrimination of students who are different for a whole host of reasons. I just did a tour of some of our sites, and I was so impressed with what a difference this program was making. Like, far exceeded what I thought was possible in a very short period of time. And it was really because of the young people and the ability of young people with that training to find their voices. And in finding their voices, they also are starting to negotiate with the administration. A component of that is also we work a lot with parents. We've partnered with Planned Parenthood, and we do a lot of training for parents because, again, we recognize that supportive households definitely help young people achieve, but in some households, they need a lot of help in trying to figure out how to be supportive. And I think, again, it's a fairly comprehensive program, and I would really invite you. We have them in all of your districts. We're expanding to 44 sites in this upcoming year, and they have, in fact, I think, really shown us where the possibility is for us to be way more helpful in both preparing young people, training young people, and supporting young people.
Can I add one more thing? Because, yeah, just embedded in your question was this increased anti-LGBT activity in Los Angeles County, and these national right-wing militant groups are here, and people in our survey are very aware of that. And so a number of people mentioned safety as the issue they'd like to communicate with you and other local elected officials, and cited examples like the protests at school board meetings. And I really want to say thank you for the very public and visible support and allyship. People in the community, as expressed in the survey, are feeling it. I know you had, TransLatin Coalition had a bomb threat recently. A number of organizations have, at the Williams Institute, we have new locks, panic buttons, we've frosted our windows, and we're on the UCLA campus. And we've met with other organizations across the county who are having similar experiences. So this is a real issue, and when you think about people like, I'm scared, so I'm not even gonna go out to an LGBT venue or organization or nightclub or Pride, they're responding to a very real threat that's happening in this county right now.
Yeah, I think that's right. Thank you so much for sharing that. Now, I'll add that the group we're working with, both in CEO, but also across departments, are exploring the role that digital hate organizing plays in all of this. I think it's been a largely sort of ignored threat that we've not quite seen. And so our team will be coming back with future recommendations on how we further address the role that social media is playing in exacerbating these challenges, both at the local level, but also throughout the entire region.
I think all of that's right, and thank you for highlighting that. I had a conversation this weekend with someone who, from a very sincere place said, why do we have to talk about this stuff so much? And, somebody who you might think as an Angelino votes a certain way, all of that was true. But I think this conversation really highlights why we have to continue talking about it, because the threats are real, they are increasing, and it is our responsibility to use the law to protect our most vulnerable and center them in the work that we're doing. And if we aren't doing that with our policies, we are missing the point of our responsibility as leaders. And so I think we have to continue having these conversations. I would like for this to be such an taken for granted issue that it's baked into all of our culture, but it's not. And until and unless it is, we have to continue this work, and I thank you for the leadership and your investment in making sure that we're doing it. I know that this presentation is also going to go to our commission, so there will be action items in that regard, and my colleagues have comments, but I'll turn it to you, Bambi, and then I'll go to Supervisor Barker.
Yes, thank you so much. I think there's a very real thing that is happening, being that there are about almost 500 bills that are across the United States that are specifically targeting transgender, nonconforming, intersex people and criminalizing their parents. We are seeing an influx of migration from all the people in California. And so I think LA County also needs to be ready to support these families and members of our community. But I do want to also highlight a couple of things that we are doing as an organization to support the livelihood of young transgender, nonconforming, intersex people. So in our services, we have registered about over 460 young people ages 18 to 26. And we are supporting them with the different types of services. We recently have a grant that was approved by the California Department of Public Health in collaboration with Children's Hospital Los Angeles. And so we are going to be supporting young people with healthcare services 16 to 25 years old. And so those are some of the things that we're doing to address the needs of young people. In addition to that, through our policy department, we were able to develop a mentorship program. So we were working with young people in different college campuses for them to be able to organize and for them to be able to also go to this protests that were happening. And so, part of the work that we do as an organization is also empowering our community. But I do have to say that there is a challenge working with younger people than 18, right, for the many intricacies that obviously, take place. But our organization is definitely committed into making sure that in the future we continue to support young people the best possible way.
Thank you. Supervisor Barker.
Thank you, and thank you, Supervisor Horvath, for asking that this be brought before our board and allowing us to have a thoughtful discussion about this. And I want to thank you all for the presentation today. You asked some of my questions, and I think you kind of answered the question, but I just want to get a clarification because I represent a pretty diverse district, and especially up in the North County. And I know that many times it's a desert for services. And so I just was curious to know from where you polled and the demographics and the geographic makeup of the participants, so I can get a better understanding in terms of the impact to the county as a whole, and in particular my district, or did you look at each area, especially areas like the Antelope Valley? I don't know who that question is to, but I think it's to you. Yeah.
Yeah, I think each of us can answer it for our two different samples. And so of the 1,000 people that entered the county survey and then the 500, we had a really great distribution across the districts. District 3 had more people. There was about 30% of the sample there, but every other district had between 15 and 19% of the sample. So we have over 100 respondents to our more detailed follow-up survey from every district. And we are able, I mean, like I said, we have about 300 pages of analysis. We are able to go back and do some analysis by district. We won't be able to break the community into subpopulations like we did with the overall sample, but we can look at differences by district and are happy to do that. I'll say this, I'll point out a few just important things when you're thinking about, okay, who are these 665,000 LGBTQ people, and everyone has like 100,000 or more of those 665 in your district. They tend to be younger than the population overall. About 40% are under the age of 35, so the sample and the community represents all age ranges, but they tend to be a younger population. Something that's a little different here than in national statistics is that we have a higher percentage of trans non-binary people here. I think people come here, and there's a reason for that because there's more community, there's resources here that aren't in other parts of the country. We also have more men, which is interesting. So there are more gay and bisexual men as a percentage of the LGBTQ community than we see nationally. And so, that could also be about who is moving here. It could be about who can afford to live here as well. But that is a difference that we see. And as I mentioned earlier, it's more racially and ethnically diverse than the county population overall. So I think you can think younger, unlike nationally, kind of more trans non-binary people, kind of a balance between men and women. We see more women when we look at national statistics and more racial and ethnic diversity.
But I do want to make that offer to everybody. I mean, for anything, and that's in that health survey, we can look at it by your districts, and we do. We also look at that often by spas.
Yeah.
And we're happy to work with Brad on this particular part of the data set. But as a reminder, there's almost 10,000 people that completed that survey. And there's a rich data set, and it's very representative. I mean, the way that they solicit people to respond and participate in the survey is, we aim to get as representative a sample as we can. And, the folks doing the surveys are spending a lot of time trying to get a representative sample. So, we can just offer offline to talk to any board office that wants to look more in depth by their district.
And I'll just add this. So there is all these great quotes in the report, and we have even more of those. And we can organize those by district as well. So I know a number of write-in responses in your district talked about the need for more organizations to locate resources there and for there to be safe spaces in your district.
And that's why I was asking, actually, because of the access to transportation and then programming social service programs, so they don't feel isolated. Can you talk about isolation and...
we think about West Hollywood and Silver Lake and
Yeah.
the traditional LGBT communities. LGBTQ people tend to live with their communities based on race and ethnicity and income. And that's kind of a myth that people are living in those communities. And so, most people don't have the luxury of moving around that much. And so they tend to be located in the communities that they were born in. And so we need services to be as spread out as the community is.
Thank you for that. And then and I think you touched on this for another survey, but I'd like to ask about the impact of involvement of the child welfare system on any of the respondents that you surveyed. Did any of the respondents have a connection to the child welfare system? And how did they express their, if they did, how did they express their experience and access to services? That's something I know we've struggled with. I know our DCFS department is making great strides in putting together programs that are more sensitive to that. But I was just curious to know if there was any feedback that y'all got. I'm looking.
We as an organization have not been able to work with young people and have not been able to collaborate with the department, unfortunately, but I think that's something that we definitely need to look into and make sure that we figure out.
Yeah, and we don't have anything specific from the survey. I mean, probably the closest thing we had, as I mentioned, we had people kind of rate how supportive or unsupportive 14 different service areas are. And I don't exactly, and I think child services is in there, I don't exactly remember where it falls, but it falls in the middle because I know the bottom four all have to do with the criminal legal system, and the top 4 or 5, people love the library. They are crazy about the library system, but they have to deal with things that large sections of the population interact with, like the library, voting, those types of services were rated the highest. So.
Yeah, I mean, I would hope that we would focus on that because I know I saw Brandon here earlier, Nichols from our DCFS department, but I have to wonder how many are in the system because of coming out or of family members who can't accept who they are. And so I think it'd be important for us to understand that side of it as it relates to the child welfare system. And then my last question, and Dr. Furr, I may have missed it. This is more just, I was looking in the report that I got here, the summaries. You talked about disability. Did you say 41%? And can you drill down on that? What exactly, I mean, in terms of, because I saw something about providers in here as well. I just want to better understand that percentage and what that reflects.
Yeah, I mean, we'd have to look and see whether there's any, sort of subset of questions that were asked around disability. I don't have that with me, but I'm happy to get that back to you. But it was 41%. 41% of our sample, which is those 1,000 sort of, I call them a representative sample, those 1,000 folks that identified as LGBTQ, 41% of them noted they had a disability.
Yeah, I'd like to get more information on
yeah.
that because I think that's important, again, from the standpoint of being a service provider, a safety net. I think it's important for us to find out what exactly that translates to.
Yeah.
And because that's a high percentage.
It's a very high percentage. I mean, I think in the general population, we see somewhere between 25%.
Right. No, I mean, that number jumped out at me.
So this number does jump out. I just don't know. I mean, we'll get you whatever we have. I don't know how many sub-questions we ask sort of like to get at more details. What kind of disability? Remember,
Well, I think,
this is...
Yeah, I think that's...
So we might have to dig in. We might have to go back and try to do some different kind of sampling to be able to answer some of these questions in more detail.
I can add one thing is the disability question is pretty general, but I think we can provide a little bit more nuance. We did ask people in the last 30 days, have you been limited in your daily activities for a variety of reasons? And the disparity between non-LGBT and LGBT people was around issues involving mental health leading to limitations in daily activity like working, taking care of yourself. So there was, the disparity is concentrated kind of in a current ongoing basis around mental health issues.
Yeah, I'd like to get more information on that, again, because I think it's important for us to understand in terms of services. And even when you talk about disability, if you're going to be applying for SSI under disability, are we in the county providing the resources and the expertise to help someone navigate that doesn't feel comfortable going into one of our offices? I mean, it's across the board, and it has a ripple effect. I want to thank the Williams Institute and UCLA in bringing forward the research and allowing us the opportunity to review the findings. And I'm going to ask you at another time the relationship and how they got you out here. So I want to thank the Williams Institute for getting Supervisor or Chair Lindsay Horvath to Los Angeles County.
I thought I was going to be a lawyer, and I wanted to be a lawyer because of the Williams Institute at UCLA. So
There you go.
We'll take credit. Yeah.
Okay, take it. Thank you, Madam Chair.
Supervisor Solis.
This is a lot of data. And actually, I think it's very, very helpful. Some of us who serve districts that have a growing population with the LGBTQ plus and trans community, just by the data you've broken down, 120,000 that we know of in my district. It's probably a lot higher because it's underreported. And I would venture to say that you sampled adults, so yeah, I believe there's a large number of teenagers and youth that is the missing data. So somehow I think working with DCFS and including DPSS families, I know that this is our shot right here to kind of get this going, and I appreciate that, Madam Chair, for having you convene all of this. This is a very important systemic problem, and it centers around our collaboration with our departments and the resources that they have. And it strikes me that whenever we have an issue, we try to come up with, okay, there's maybe an organization that we can develop. We have now an LGBTQ plus commission, and that's great. But I also don't want to see that commission overburdened, just like Artie, to say you're going to solve all the problems that we're talking about today. Because all the departments that we oversee have an obligation, and they probably are serving in some way or another and touching this population, which is so broad and vast. But we need to have them also weigh in here and to give us what the data is from their respective services, how that breaks down. And if we see any gaps there, I would love to see what you all, Williamson Institute, as well as our commissioners on the LGBTQ plus commission, weigh in and give us, and our CBOs, to give us this information, where we can do a better job, where those barriers exist right now. And I want to say I am just really happy to see the data and to know that we have such a large population that is underserved. And it isn't just in my district, it's around the whole county. And unfortunately, there aren't many places, even in the district that I represent, which is part of Northeast LA, and I represent Silver Lake and all those, and they're much more advanced in terms of services that they've been providing. But there's a vast gap, an island, so to speak, that exists between the 710 freeway and then going east. And I would say to you that it's problematic, and that's why we are seeing, I think, a lot of adverse outcomes, disparities in health, in economic well-being, in job opportunities, and all of that. And I do believe we could weave in our other departments to help us. So number one is the health. So it isn't just, I thank you for being here, Dr. Ferrer. A lot falls under your purview, but not all of it. DHS has a responsibility here with our young people and telling us where our clinics are strategically located in these areas that should be addressing these issues as well. And that has to happen. The mapping has to happen. And also with Department of Mental Health. I'm very concerned that they're not at the table. Maybe that's the next phase of the next report that we do, but finding out also where they are at. I just want to say, I recall years ago when I first started here, I went out to visit a program that was being administered in the city of Baldwin Park and City of Industry. And it was a drop-in center for young people, for TAY, Transitional Age Youth. And when I went and visited, I saw LGBTQ plus students, kids, not even, I mean, I don't even know if they were students, maybe they were dropouts. But they would go there for respite, for showering, for meals, for a locker. I don't even know if we're doing that and to what extent that we're still carrying that out. And that's just a very small part of what I think is necessary. And that isn't the way to, to me, that's a Band-Aid. We need to be more structurally involved and using our resources because we have clinics in all of our districts, public, mental health, and all of that. And we should be carving out a portion that says, here's a person you can talk to who not only may look like you or not, that doesn't matter, but they can also speak your language and understand your culture. And I'm very concerned about the fact that I am seeing, and it's not startling, 39% or 2/3 of the LGBT adults are people of color. 39% are Latino, Latina, whatever, Latinx. It's reflective of the county, but it's not reflective in the terms of services to our communities that we all represent. And I have a big issue with that, and have for a long time. But I'm glad that now we have data to help direct us, because it isn't just that community that I represent. I also have a growing AAPI community that feels just as terrorized and also under the gun, so to speak. And they also need to have avenues to be able to connect with our departments. So I do want to see a more robust plan coming forward, because everything that was raised by all of you, and Bambi, thank you for being here and telling us about all the hard work that you're doing. And I'm sorry what happened in El Monte when you opened up your trans center there, LGBTQ plus center, that they were allegedly, there was going to be a firebombed San Gabriel Valley. And that sends a shock to all the people in our communities, especially communities of color and people who are, through no fault of their own, just trying to get ahead, trying to get help because they are intimidated by going to the government. So I agree with you that we have to have CBOs and other clinical providers that know this and are experts there. And we need to be allowing for those dollars from our departments to be strategically set aside for them in all of our departments. And that includes not just the Department of Health, triage, all of that has to happen, but I'm also thinking out loud about the Office of Economic Opportunity, because they handle workforce investment as well as micro-entrepreneurships. So that's another way of creating wealth and helping people to stabilize themselves and create their own jobs and create their own businesses, but also making sure that that is carved out. Because right now, if you were to call maybe any of these departments, I doubt that any of them are going to say, oh, well, we have an office that's exclusively committed to that. And I know that there's probably the argument by some people will say, well, why should we do that? It's for everybody. Not really. Not really, when you have almost 40% of the Latino, Latinx community and other people of color that are highly represented here. They don't feel comfortable. That has been our problem, the culture. The culture also of our own institutions not receiving and understanding how to work with these individuals. I agree we need to bring more people in that are reflective in our jobs with the county, but also when we contract opportunities, that should be made available, and how we also provide technical assistance, not only to businesses, but also to CBOs. Because there are CBOs that want to stand up services, but they don't have the capacity because they don't know how to go through our quagmire of red tape. And there should be some efforts to carve that out. And that brings me to something, Bambi, you brought up about migration and immigration and status and also IDs. That is something very critical. I keep hearing over and over again that undocumented or mostly migrant or immigrant, trans and LGBTQ, wherever they may fall, are having a hard time in accessing everything, even whether it's homelessness. There are providers out there that I know that won't even allow for them to go into into housing or receive those vouchers. And some are restricted because of federal guidelines, but not all of them. And we need to have a repository of information where we can start to have a screen and a dashboard that shows all of that, where people can go in their language. And I think it behooves us to start doing it now sooner than later. So I don't want to, I'm sorry, I'm kind of sound like I'm on a rant, but I'm not. I'm very concerned and have been. And I know that in communities like mine, there are young people who are standing up their own makeshift centers. In El Monte, we also have LGBTQ Center. The city of El Monte actually set aside through their Parks and Recreation Department an office so people can go to. They have also been threatened recently because of pride activities and things of that nature. what kind of a message are we sending, and where is our law enforcement, not just the sheriffs, but our local PDs? How are they also getting messaging through our Human Relations Commission or ARDI to be able to sensitize them and how to work with this community? Because I see that as the next bump that we're facing, because sheriffs only go so far, but we have other PDs that are out there that may not be looking with the same lens, or perhaps, I don't even want to say sensitivity, that's maybe not the right word, but knowing what they should be looking for and how to interact with groups that are already out on the field to learn from them as well. I think there's just an outline of many, many things that you all can do, and I'm looking at our executive commission, I'm looking at, all of you. If you have any comments, please, I'll stop right there.
Yeah, thank you so much, Supervisor. And I do want to note that we've already undertaken that effort that you asked for around making sure that all 3 health departments are taking a look at our programming, taking a look at our sites, making sure that we are offering affirming care to the entirety of the LGBTQ community. I mean, they're not here today just because this was a shorter presentation just on the survey results. But I want to assure you that all 3 departments are working really hard and feel deeply committed to making sure that the county services reflect what the board has asked us to do. And I also want to note that we presented data just from these 3 surveys, but I know that departments like DCFS and DPSS also have data that you requested today, and we'll be sure to make sure that that information gets to you. We're not. This is
Right.
just from this sampling of people who live in our communities, but it doesn't necessarily reflect all the data and all the information we have on the communities we're serving.
And we have a new agency, Aging and Disabilities.
Yes.
I would like them to respond. We have a new director there to tell us what actions, as a result of this information, we're going to see moving forward. And having those discussions with you all, I think, is going to be very critical.
And I think if I could say something from the position of being the executive director of this newly formed commission, for me, success never happens individually. It is a collaborative effort. Look at how incredible this collaborative effort was that brought us this rich information that we'll be able to utilize moving forward. But for me, it's also looking around the county at the 38 departments and saying, how are we collaborating with them to understand how we can support the LGBTQ plus community from, throughout the entire life cycle, from inception to birth to death and everything in between. How are we supporting those of us who are the most held back or who have not been given privilege or support or access or don't know how to access it? And then on the county side, from employees' side too, it's how are we training our employees to understand that the LGBTQ plus population is part of the county. We are deserving of respect and equal rights, and what does that look like, even if your belief system might not align with that. But how do you provide somebody with respect and the support that they're supposed to get? And so really looking forward to working with all of the folks here, with all of you who've been so supportive of this, and with a lot of the community-based organizations that have the information that we're seeking that isn't easy to find in the traditional research methods. And I know you all did an incredible job to get into the community, but really partnering with them as well. So looking forward to that.
If I may also, I think right now we have a really great opportunity to address some of the things that the members of the transgender and nonconforming intersex community faces. And I do want to speak specifically of an effort that the TransLatin Coalition is taking on. So we have had the opportunity to purchase a piece of land in your district on specifically 5314 Sunset Boulevard. And the TransLatin Coalition is going to build a state-of-the-art center specifically dedicated to uplift the livelihood of transgender and conforming intersex people. And I think it's important that we recognize that something like this has not happened anywhere in the United States. And there is an opportunity to really invest in the livelihood and in the future of members of our community. And through that also, I think it's important to recognize that through the effort that we're leading in collaboration with other trans organizations, we have the opportunity to create a and care for transgender experience and county support to be able to serve communities. So I think there's definitely a opportunity for us to see how we are serving here locally.
I was sitting you on this somehow I just say all of things or it just feel I was and question is it like segregated that you could write, and I appreciate your comment about the emerging population is of color younger and where they can live, and so we do be clear about who the bears that we really what motion data you gave us was recommendations frustrated or we get these even the record that is true and painful. Where they've been denied housing due to being trans or non-binary, 9% treatment in root healthcare visits. That's 50% with government, 50% more probably for delivery. And I don't right. So when government we should be supplanting government. We have a problem. When I look at two ways and show capacity. So address things with Addison ideas. We have your opportunity to ensure that that are responsible for services, determining ability and make sure our opportunity to have the opportunity to fully engage themselves in craft. Listen to in the I pick your comment about training term communication. What I have is this that proves will there the term but we keep from the
with our field, and work with our party, to get a will ahead and ignite that is work very well. Able to observe
something that we think about the need to convey. So we really see is the basic full and I say about county ever had much they have how do we know if we proved that? It's clean important. Key time surveys are people their questions. They are their starts reading ahead. Line
some people
so we have control I do say in our days on portal you can everybody and we are in of words and really talk about the make including
Right. We given the presentation to me to run it, but you know, and months to survey.
I think more that's a fix. And so I think and and still have I don't want to organize finances, including on how to remove the in terms to also to you know where meaning how we can work together to
our myths. And I think about the less government there for a is where we and what they have that as you build out housing mechanisms, we have to be told how you authentic are the restrictions we like to but that having like way to counsel when it comes really capturing
So really change your and I relate the interest being and how people should be. I think that has to do that we try to upend but it's so at some point survey down so we have to survey out and not access to that $3 billion budget and the experience of that affected her like the goal. I think that LELAC recommendation brought forth help us there. I want to say that my day longer process we are in the meantime and in the meantime he can't law behavior seen her and has their government and its default stability of our community-based organizations because that your job should not plan but to augment the experience and services.
If I very lucky that we are now the biggest translator organization in the United States, and we do have a strong policy demand, and we are definitely looking forward to work with all of the offices of all of you so that we can figure out ways to make sure that we have those legislation in place, but that we also ensure that there's an implementation process and a quality process through that, right? Because one of the things that we see is that it's hard to measure the invisible discrimination that happens against trans people, right? And so how do we make sure that people who we first encounter, right, are understanding and sensitive enough that we are human individuals and that we deserve to be respected and treated with dignity as everybody else. And so even a gesture it could be degrading, right? And so
absolutely.
we have to make sure that we find those accountability processes in place so that we can hold accountable those individuals. And I also want to say that we as an organization, part of our strategic plan is to ensure that we invest in our communications department, and so that we, through our own content that we create, we hopefully are able to create consciousness in people and be able to shift the way people think of us and the way people think of how they treat us. And so I'm really proud and grateful to all of the staff who work at the TransLatin Coalition because we do a lot with not enough resources. And so thank you, staff members of the TransLatin Coalition.
Thank you, Madam Chair. Thanks to the panel. Appreciate you.
Thank you. We are now going to go to our members of the public. I know that you all will have a lot to say and be excited about each other. So if you are in support of what you're hearing, please indicate this way so we know that you are supportive, but we can hear the speakers who are speaking. And if you disagree, you can do this to let us know you disagree with the speaker, but we can keep the comments moving. Thank you very much. Executive Officer, please call members of the public who have signed up to speak on this item.
Will the following individuals please come forward? Ana Gonzalez, Alberta Franklin, Azul Love, B. Kroll, Byron Jose, Sheila Demure, Diamond Cruz, Erica Mosley, Joanna Wallace, Lisa Cabellas, Loretta Lorraine, Matt Inouye, Maya Daniels, Mito Avies, Queen Victoria Ortega, Red Chief Hunt, Rita Garcia, Scotty Jeanette Madden, Shannon Gibson, Tiana Herrera, and Terry J. Please come forward and staff will assist you. For participants on the telephone, as a final reminder, if you would like to address item 4, if you have not already done so, please press 1 then 0 now to be placed in the speaking queue. Moderator, when we have the first remote speaker, please.
Our first participant is Roy Humphreys. Please unmute and speak directly into your phone. You may begin.
Mito Avies, Queen Victoria Ortega, Red Chief Hunt.
Are you there?
Rita Garcia, Scotty Jeanette Madden.
Caller, are you there?
Shannon Gibson, Tiana here.
Let's go to the next speaker, please.
On the telephone.
Sounds like Mr. Humphreys may be monitoring the webcast instead of his phone. Our next participant is Eric Previn. Please unmute and speak directly into your phone. You may begin.
Thank you. It's Eric Previn from Studio City. And I very much appreciate this survey, a series of surveys that have revealed a lot of stuff. And I think that, you know, the emphasis that the county is on trying to make the experience, you know, a quality experience when dealing with the county and being respected and getting services is a great area. I don't like hearing about quagmire of services and CBOs wanting to stand up but bogging down in, you know, I think we need to get Davenport in on this with the sleeves rolled up. And I think, you know, the person who was saying that it's not really the job to supplant the government, but to support it and to augment it is the right idea. But I was thinking maybe we should be doing a recognition like we do for the indigenous people at the beginning of every meeting, because I feel like dragging it out on a policy hearing is fun.
Next speaker, please.
But I want to do it every day.
Our next participant is Ace Anaya. Please unmute and speak directly into your phone. You may begin.
Good morning, supervisors. My name is Ace. I represent Gender Justice LA, an organization that is by and for the BIPOC, transgender, gender expansive members. Although GJLA has supported TGNC for over 20 years, we're just newly located in SD1 in the heart of Lincoln Heights. For Supervisors Elisa and Mitchell, I appreciate mentioning the Department of Mental Health, as well as how can we do repeat surveys, and I want to uplift the Two-Spirit LGBTQ underserved community subcommittee as potentially benefiting from the TGI Wellness and Equity Care Fund. And I want to express my extreme support for the $7 million investment in transgender, gender expansive, and intersex communities. Thank you very much.
Thank you. Next speaker, please.
Our next participant is, again, Roy Humphreys. Please unmute and speak directly into your phone. You may begin.
Can you hear me?
Yes, we can. Go ahead. Thank you.
Okay, good morning to the Felony 5. And as Dirty Harry says, man must know his limitations. You say, do this, do that, with pathetic pandering, knowing you haven't got the funds to scratch the surface and shoving this lifestyle down the throats of the 94% is getting pushed back. Austerity is just around the corner. Start living within your means and guarantee basic rights to those with this lifestyle within the real realm of terms, and have the respect that does due them, and engage this lifestyle, but give appropriate respect. Thank you.
Thank you. Next speaker, please.
Madam Chair, there are no other remote speakers in queue to address the board.
We'll go to speakers in person. Please go ahead.
Board of Supervisors. My name is Ana Gonzalez. Before of anything, I wanted to say that I feel so powerful to have a member of my community in the table, and also that is really important for a person like us to be able to represent us, because they will know the best for us, you know? So thank you, Bambi. I love you. So I am talking on behalf of Good Morning Board of Supervisors. I'm here today in support for the transgender, gender expansive, and intersex people quality of life in Los Angeles. I'm here and I work at the TransLatin Coalition. I live, work in District 2, and I asked the Board of Supervisors to establish TGI Wellness and Equality and Care Coordination and the $7 million invested for our programs. Thank you.
Thank you. Next speaker. If we could please hold applause in between speaking and do this so we know, we'll go on to our next speaker. Thank you.
Hello, Board of Supervisors. My name is Alberta Franklin, and I am the Programs and Services Reentry Coordinator for the TransLatin Coalition. I was once a client. So when I came to TransLatin Coalition, being African American, I was accepted. I've been accepted. I even think that I'm being loved. So I live in District 2, Supervisor Holly Mitchell's district. I want to talk about equality and equity. Equality may take more time, but the Board of Supervisors can deliver equity through passing and improving the TGI Wellness, Equity, and Care 2024. Equity. Give us our fair share. Give us equity. Thank you so much, Board of Supervisors. Bye.
Thank you. Next speaker, please.
Estimados supervisores, mi nombre es Joanna Wallace y yo trabajo para la Coalición Translatina.
Dear supervisors, my name is Joanna Wallace and I work for the TransLatin Coalition.
Que está ubicada aquí en Los Ángeles, California, pero yo vivo en el distrito número 3.
And it's located here in Los Angeles, California, and I live in District 3.
Estoy aquí en apoyo de la TGI Wellness Equality and Care of del 2024, una inversión de $7 millones en la comunidad de transgénero, expresión de género intersexuales en nuestra comunidad.
I am here in support of TGI Wellness Equity and Care 2024, a $7 million investment in transgender, expansive, and intersex communities.
Ok, un momento. Las personas que atenden a los servicios de TGI, pues, las personas que atienden a los servicios TGI, pues, les pedimos a los servidores del Condado de Los Ángeles que inviertan realmente en la vida de la comunidad trans, de expansión de género y intersexual en todo el Condado de Los Ángeles y todos los departamentos.
So for those TGI individuals that are accessing services, we ask the LA County Board of Supervisors to truly invest in the lives of trans, gender expansive, and intersex communities throughout the county and across all of the departments.
Esta inversión de $7 millones en organizaciones comunitarias dirigidas a la comunidad TGI, a los servicios TGI, es un paso crítico para la comunidad, asegurando en la equidad, elegirse con otras actividades de la justicia.
This $7 million investment in TGI-led and TGI-serving community-based organizations is a crucial step to be able to ensure equality across all different sectors.
Thank you very much. Thank you. Next speaker.
Good morning, everyone. Byron Jose with the TransLatin Coalition, SD2 constituent. Thank you to the board and the county departments for the presentation and the partners. I also wanted to say thank you to community members who are here today. They participated in all the surveys, but they also participated in the town hall that was led by Artie as part of the TGI Needs Assessment Motion Report Back. So gracias por estar aquí. A todas las personas, specifically aging population, specifically Black and Latina trans women. We look forward to working with the CEO, with the executive office for the next meeting, so there's interpretation in Spanish for some of our members. As shown in the key findings and the TGI Needs Assessment Report Back introduced by Supervisor Mitchell in 2022, we continue to see the challenges in accessing care and coordination throughout all districts and across all departments. So we look forward to working with every office to ensure that it is put as an unmet need to make sure that it goes up the priority mountain for the CEO. Thank you.
Thank you. Next speaker.
Good morning to the Board of Supervisors. My name is Queen Shannon. I'm the Chief Operating Officer for Unique Women's Coalition, the first and oldest Black trans-led organization here in Southern California. And I was also one of the recruiters who assisted with connecting community to providing this data to the survey today. And I just wanted to say one of the most effective ways to combat these challenges is by empowering those who are the most affected, by supporting and allocating resources to trans-led organizations like Unique Women's Coalition, TransLatin Coalition, the Trans Wellness Center, and APAIT. These organizations not only are familiar with the specific needs and struggles of my TGI community, but we are also driven by deep personal commitment to creating meaningful change. Thank you.
Thank you. Next speaker.
Okay, you know, I'm Miss Loretta Lorraine. I'm here. It's just so beautiful to see so many ladies from organizations come together, Black, Mexican, white, all of us, even Miss Bambi Lucido, Queen Victoria, and all of them. I am so proud to be here because I speak the truth. We always have been put in the burner. I'm talking for the senior ladies like me, that we need help because the rent's going up, everything is going outrageous for older people. There's people dying in tents every day because they can't afford rent, because now they have senior stuff, but why they don't have it for the transgender ladies? We're here to fight to make sure you give all those organizations what you're supposed to give them. Now start signing those checks, ladies. But you know, it's so beautiful to know that they're here making a difference for our organizations. All those ladies are in power. They're doing beautiful work. And
thank you. Next speaker, please.
Hi, my name is Erica Mosley. I represent the TransLatin Coalition. I'm part of the reentry program. And the reason why the TGI, the wellness, the equity in the care, this $7 million, the reason why it's so important is because they're trying to support as many of us as they can, and we need resources. And for a lot of us, this is our only family. This is our only support. We don't have anywhere else to turn. And I mean, as you know, everyone already talked about the cost of living and the prices of resources, all these things like that. There's limitations, so we need as much support as we can get. And without this, I mean, the hand's gonna be tied eventually one day if we're not supported. So this is very important. Thank you.
Thank you. Next speaker.
Hi, my name is Diamond Isabel Cruz, and I'm here on behalf of the TransLatin Coalition. I'm here advocating for the 2024 $7 million equity fund. The TransLatin Coalition has played a pivotal role in my journey after my release from prison. The unwavering support and dedication has provided me with housing, education, and job opportunities that have been instrumental in rebuilding my life. I am immensely grateful to the TransLatin Coalition for creating a safe space where I can truly be myself. Their commitment to empowering transgender individuals like myself is nothing short of remarkable. Words cannot express the depth of my gratitude for the transformative impact that that they have had on my life. Thank you to the TransLatin Coalition for helping me find my way and giving me the opportunity not to only survive, but to thrive. Thank you, Bambi, and have a nice day.
Thank you. Next speaker.
Hello, everybody. My name is Azul Lop Ruiz. I am indigenous from Oaxaca, Mexico. I just want to say thank you so much, Bambi. Thank you for being there for me. You helped me up. And what is this important? Because you saved my life. A program like this saved my life, you know. Now I'm working for the St. John's Clinic. I'm part of the CDC department, and I really, really appreciate that. This is really important because people, a transgender human being, is dying over there on the streets, you know. I mean, I can see that because my location is by Avalon and Florence, and I can see my people being there, and because of these programs, you know, we go to them, and they have access to get a better life and to see hope. And I'm in favor for this because I am an example that everything is possible because a program for this took me out from the street, and now I have a beautiful, amazing life with dignity. Thank you so much.
Thank you. Next speaker.
Ja, det Terry Janish, Twitter Janish, Hi, good afternoon. My name is Terry. I am a member of the Navajo tribe, and I am here having a voice on this particular topic on TGI focus only. And this is one of the things that I want to be able to express. I live in District 1, and I also work with TransLatin Coalition. I am a program manager of the housing programs, directly working with TGI communities. TGI people are faced with discrimination. They are unhoused. They don't have any services or have barriers in linking with mental health services, substance use services, and also with other services program. So with the $7 million investment is to provide wraparound services to get our TGI housed, services with mental health, substance use services, housing programs, long-term permanent housing program. Please invest in TGI population.
Thank you. Next speaker.
Hello, everybody. My name is Susha Roadhouse. I am an Egyptian Pacific Islander, straight from the descendant of King Kamehameha. It is actually June 18th, so June 19th, everybody celebrate. This will be another celebration for our BIPOC and Black transgender community. I just want to let you know, as a trans man, okay, to stand up here with all of you beautiful women, and I'm speaking to you men out here, all right? This is what I'm gonna say. All I'm gonna say is that all transgender, after a certain period of certain surgeries, once we get done with those surgeries, we have to take that medication for the rest of our lives or we die. I don't know if you guys know, but the expectancy, the life expectancy of a trans individual is 35 years old. That's almost 85 years less than a natural human being that calls themselves a cis. So if you all care about your community and don't want to be murderers, join our team. Thank you.
Thank you. Next speaker.
Primeramente quiero saludar al todo el pueblo de Los Ángeles, de las personas transgénero y no binarias que están aquí. We would not be here without you. My name is Queen Victoria Ortega, and I just said that I wanted to give thanks to the people of Los Angeles, the trans people of Los Angeles who have showed up to support this initiative. My name is Queen Victoria Ortega, and I'm the Chief Visioning Officer of the Transgender Empowerment Center, as well as the International President of Flux. I had the distinct privilege as a consultant to also work on the study, doing research on the ground, not only on this study, but many actually prior studies leading back to 2003. I wanted to say from this queen to what I refer to as the 5 queens of Los Angeles, that the time for proclamations during Pride has come and passed. It's time for us to have equitable and tangible investment in trans lives through the creation of a fund like the Wellness and Equity and Care Fund that is needed and is urgently needed for our trans community. So what will your legacy be is the question I leave you with. Thank you.
Thank you. Next speaker.
Hello, Board of Supervisors. My name is Lisa Marie Ceballos. I'm one of the program coordinators
for the TRUE program at the TransLatin Coalition. The TRUE program works with the City of West Hollywood, funded by the City of West Hollywood, on supporting TGI community that works, study, or is navigating homelessness in the City of West Hollywood. An exceptional program that has made a difference not only in changing TGI lives for the better, but now this year with the workforce. I want to invite you to look at this program and see the change, tremendous change that it has made in our community, and sample that or collaborate with the City of West Hollywood to be able to extend this program all over LA for our TGI communities. We have been able to place people in jobs, refer people, get people into housing, and if you guys were to come and see how this program has been a success, maybe we can duplicate that program and do it for the City of West Hollywood for TGI communities. Also, I'm here standing today as one of the international outreach directors for Flux. And
Thank you. Thank you very much. Next speaker, please.
Good afternoon, Board of Supervisors. I want to introduce myself. My name is B. Curiel, and I serve as a training coordinator at the TransLatin Coalition. And I currently lead the Cultural Transformation Training Series training department. So my work entails going into community-based organizations, providing training, as well as technical assistance. And the majority of the work that I do is with shelters and homelessness services providers, whether it's training outreach, training case managers, clinicians. And I've been doing this work around LA for about a year and a half, training over 500 individuals in the county in both English and Spanish. And I have a lot to say, but I just wanted to take this time to introduce myself and to know that it is no reason, or there is a really good reason why there's so many folks seeking services at the TransLatin Coalition, and it's just very needed that LA County funded CB.
Thank you. Next speaker.
Well, good afternoon. Board of Supervisors, my name is Tiana Herrera, and I'm with District 2. I work for St. John's Community Health, and I've been working there going on 8th year. This is my 8th year anniversary. And I just want to know, we need to invest more money on our transgender community, especially for mental health. And not only as an interventionist, there's a lot of individuals from my community suffering with mental illness, substance abuse, and also with housing. Also, not only based on our community members, but also for those that are employed, there are trans individuals, the cost of living is so expensive. So basically, we are only working just to pay our rent and a little bit of our bills or our car notes or insurance. So I'm advocating not only just for my community, but also for everyone in general. Thank you very much.
Thank you. Next speaker.
Good morning, everyone. My name is Scotty Jeanette Madden, and I am the Director of Advocacy for Flux and the Connie Norman Transgender Empowerment Center. I'm also part of HRC, and I'm also the board chair of the Trans Chorus of Los Angeles. I tell this to you for one reason. First of all, thank you. The fact that this survey was commissioned by the Board of Supervisors proves to me that all of the votes that I put in for all you all went someplace that I needed it to go. Secondly, I want to thank Bambi Salcedo, first of all, for her decades of support, but also for the way that she leads the TransLatin Coalition to fill in the gaps that was so obviously pointed out through this report and in what has been said by the supervisors this morning, and in particular, the Williams Institute. This is the kind of data that this is what the board needed to go forward. But one thing I do have to say, in requesting additional information.
Thank you. Thank you very much.
You're welcome. We learned that all of the data that was collected.
Your time has expired. I'm so sorry we have to go to our next speaker. We have more speakers, but I'm happy to hear the rest of your comment afterwards. Next speaker.
Good afternoon, everyone. My name is Rita Garcia. My pronouns is she and her. I'm an Afro-Latina trans woman, and I'm living example of what opportunity and resilience looks like. I am currently the Violence Prevention Program at the and manager of the TransLatin Coalition, the largest trans-led organization in the United States. We are celebrating 15 years of uplifting the livelihood of marginalized and targeted TGI individuals in Los Angeles. Today, I am here in support of TGI Wellness, Equity, and Care 2024 and investing in transgender, expansive, and intersex community. This investment will allow us to reinforce and create more programs that transform and navigate lives using a harm reduction model. We aim to support individuals transition from street to safe shelter, providing access to health care and medical insurance, mental health and legal support, workforce development, job-seeking assistance, and other resources that prevent TGI's individuals from.
Thank you. Thank you very much. Next speaker, please.
Hi, good afternoon. Hola, buenas tardes. My name is Mito. I am the California Health-wide coordinator for the TransLatin Coalition. And today, we must acknowledge the ongoing struggles that trans individuals face. In many parts of the world, and even in our own communities, trans people are denied access to essential medical care, face discrimination in the workplace, and are targets of hate and violence. Policies and practices that infringe upon the bodily autonomy of trans individuals not only violate their human rights, but also perpetuate a cycle of marginalization and injustice. To move forward, we need comprehensive legal protections that affirm the rights of trans individuals. We must advocate for inclusive healthcare policies that provide necessary medical treatments and psychological support without barriers or stigma. Education awareness campaigns are vital to dispelling myths and fostering a culture of acceptance and respect. Let us commit to this cause with an understanding that the liberation of one group is intrinsically linked to the liberation.
Thank you. Next speaker.
My name is Veronica Fernandez. I'm the program manager for the St. John's Community Health Transgender Department. Today I stand before you a proud, resilient transgender Latina woman to address a matter of profound importance and urgent necessity. In recent years, the conversation around transgender rights and healthcare has gained significant momentum. However, despite these advances, transgender individuals continue to face disproportionate barriers to accessing quality healthcare. Discrimination, lack of knowledgeable healthcare providers, and systemic inequities create an environment where the healthcare and well-being of transgender individual people are compromised daily. In Los Angeles County, a place known for its diversity, a progressive value is in the moral duty to ensure that every resident has access to comprehensive and equitable health care. The establishment of trans wellness and equity care is not just a healthcare initiative, it is a commitment to human dignity, equality, and justice. Transgender individuals.
Thank you very much. Next speaker, please.
Greetings, Board of Supervisors. I am Queen Sheila Demure. I come before you today wearing many hats, but first I'd like to say thank you, Bambi, for the efforts of this survey. It is very vital and important. I'm also the founder of Unique Women's Coalition. We are the oldest trans-led organization here in Southern California. You may not know me, it's because we organize differently in our community. So we organize through the streets. And so I've been a community mother for the past few decades. And so I've had to shelter, educate. I've had to do everything that a parent should do. But because these kids were displaced from their born families, our community had to step in. So I urge this board to support this fund as it could help us move from barely surviving to thriving. Thank you.
Thank you. Next speaker.
Dear Board of Supervisors, my name is Maya Daniels and my pronouns are they, them, and I'm an intern with the TransLatin Coalition, supporting with several of their advocacy campaigns. I reside in District 1, and I'm also one of the many survey recruiters who collected data from transgender and gender nonconforming folks across the districts to partake in this quality of life survey. I am here in support of TGI Wellness, Equity and Care 2024, a $7 million investment into transgender, expansive, and intersex communities. TGI youth and aging populations are vulnerable to harassment and exclusion, causing events leading to negative health outcomes, involvement in the juvenile justice system, and especially homelessness. These similar stories echo throughout our communities and are felt at an alarmingly young age for many of us. We are grateful to those individuals within the county that see that equity for LGBTQ plus communities and our fight for racial justice are connected. I implore you as government officials to invest into these communities so that we can prevent further struggle.
Thank you. Next speaker.
Hi, everyone. My name is Matt Inoue. I use he, him pronouns, and I'm the manager of policy and community engagement with the TransLatin Coalition. I want to give a special shout out to the community. The community is amazing, and they showed up today, so thank you, community. I want to thank my boss, President and CEO of the TransLatin Coalition, and all the other organizations represented here today. I'm really here to advocate for my friends, my family, siblings. They are a community of resilience. They are a community of love, care, and they need to see that from the county as well. So we will continue to fight. We are going to continue to show up and make noise on behalf of all TGI people. We need money. Trans-led organizations need funds to uplift the TGI community, the community that they serve and are part of. So I'll continue. We want to work with the LGBT Commission. We want to continue working with your offices. So we're going to show up. We're going to be present, and thank you.
Thank you. Next speaker.
Germany, sirs and miss here. My name is Franklin Celedon. I'm transgender, and I am here for support TransLatin Coalition, because we need real support, because that is the example. I'm here. I'm really strong on my life. I'm survivor for tribe. 2 months here. I don't have a medical already. I'm here and I'm home there. So we need it. This is not TransLatin. Don't have everything the support for tribe get everything transgender be. And now I'm open. I think it's not just for Latinas. We need to open the organization for both trans and the United States, not just Latina. Transgender and born, and the born from here, they need to help too, because I believe so many transgender from and born in the United States. Thank you.
Thank you. Next speaker.
Thank you, Red Chief Hunt. Everybody counts. You guys put your hands up. Tell them you guys count. You guys come down here to count. $7 million is not enough money for these people. We need about like $20 million to start them off. They're human beings. They're beautiful. No matter what they believe in, no matter what their gender is, they're beautiful. Everybody counts, whether you're black, green, red, yellow, white, or indifferent. Please give them everything that they ask for. And you guys, please still keep on coming. Put your hands up and let them know that you're here. That's the only way you're going to let them know is that you're here. Give them everything that they want. I'm voting for $20 million so that they can have everything they need. Hey, keep up the good work. The board of directors, hey, Charlie's or Red Chief Hunt Angels, give them everything.
Thank you. I believe that was our last speaker, so I want to thank our panelists. I know you have a very rich presentation that you've shared with us. Is there anything you'd like to leave us with as you depart that we haven't touched on? I know there was a lot that we didn't talk about, so I just want to offer that. Yes.
I just want to once again acknowledge members of the community who, for centuries, have been resilient, and although there have been many efforts to erase our existence, our community are still here, and we will continue to be here. And in order for us to continue to be here in a progressive and beautiful way, we need for all of you to really invest in the livelihood of our peoples and understand that we can have a better future, that enough is enough. We need to live dignified lives, and we need to be able to thrive and show the world that we are capable of doing anything and everything. But it will require all of your support in order for all of us to make that happen. Thank you so much.
Thank you.
And since it's Pride Month, I'll just quickly end that one report we didn't talk about that much today is a report where we asked members of the community, what does the community contribute to Los Angeles? And they talked about contributing to diversity and to the arts, entertainment, culture of the county. They talked about doing that public interest work, the advocacy work, not only on behalf of the community, but on behalf of everyone. And they talked about sharing values, like living with pride, sharing with other people, non-LGBT people. You can live your lives authentically and live out loud and proud. And so when we think what it means for LGBTQ people not to be afforded to stay here and live here, the county really loses part of its unique identity. One of my favorite quotes, then hundreds of quotes that are in reports, is we ask people, what do LGBTQ people contribute to Los Angeles County? And one respondent says that without LGBTQ people, the county would be nothing but traffic. So we want to make sure that people can stay here and afford to continue to live here with pride. Thank you.
I love that closing thought. Thank you very much. This report is received and filed, and hearing no objections, that will be the order. Thank you all for being here with us today.